I would like to talk about different measures to present clinical studies. And this is a tool often used for communication of results of a clinical study. And how you present the results can have a huge impact in sensation and almost propaganda. As an example, I have this article from The Sun from end last year, from November 24, which says, HRT risk. Doctors must warn women. HRT treatment for menopause increases risk of cancer. Well, that's pretty shocking. The Sun has shocking news, but HRT, hormone replacement therapy, has been commonly used for decades in quite a few countries. So we want to unpack this messaging, and this is for any of this sensational news. What I do, I go back to the source. I want to know what came to this conclusion and then make an informed decision about it. So they say NICE has issued the first discussion aid to help GPs and patients discuss perils. All this very strong language. So NICE is an UK institute, a National Institute for Healthcare and Excellence, which provides guidelines on how to treat patients. And they normally have a lot of evidence to support that. So they have looked at all these clinical studies to make these decisions. I went to the source material, and this is what they report. So this blue table comes from that report. So the number of breast cancer cases over 5-year period per 1,000 for women, 55 to 59 year. So very specific group. So it's women between 55 and 59, and they have cases per 1,000. So for every 1,000 women, how many have breast cancer? And they have two groups, also really important. Start hormone replacement therapy at the age of 50 and use it for 5 years. So if you used it for 4 years, you're not in this study. If you used it for longer than 5 years, you might be in that study. If you used it for 4 years and 9 months, are you in that study? According to this definition, not. And they compare it to never used HRT. Quite a few women have used it perhaps for half a year or so. They're excluded. So anything in between is excluded. What do we see? We have 16 women per 1,000 who have breast cancer following, who had HRT at 50 and used it for 5 years, and 13 never used. So here you can say doctors must warn women in menopause about HRT use because there is an increase. Now I'm going to unwrap that a bit. What type of statistics can you use for this? It's very simple statistics. One of the most used statistics is relative risk. So how much more often does something happen if you have treatment compared to if you don't have treatment? And it's a very simple calculation. It's just 16 divided by 13 per 1,000. So you get to 1.23 here. What does that mean? If it's 1, then you have the same risk. So anything above, you have more risk. Anything below, you have a lower risk. So what this means is there is a 20% increase in the risk of getting breast cancer if you have taken HRT for 5 years. So what will be the sensational news in the newspaper? Doctors must warn women in menopause about HRT use with a 23% higher chance of getting breast cancer. 23%, wow. You need to be scared. Or do we? If we're looking at absolute risk difference, so what's the absolute differences? It's 16 per 1,000, so that's 1 point and 13 per 1,000. So 1.6%, 1.3%. So the difference is 0.3%. Okay, there is a 0.3% absolute increase in breast cancer for women who have taken hormone replacement therapy for 5 years. So the messaging now is doctors must warn women menopause about HRT use with a 0.3% more women getting breast cancer. So that's 1 in 30 women gets breast cancer. If you use it for 5 years, compared to never used. So most likely, if you use it for a year, you're probably in between there. So it's an even smaller risk. And so even this message is still not correct, because we have removed that 5 years that you used it between 50 and 55. That's lost in this messaging. The last way to say is how many women treated with HRT, how many women will be treated before 1 woman has a harm. And so if you treat 333 women with HRT, there will be 1 additional case of breast cancer. This is a whole mouthful, but it gives a kind of perspective. So we have a lot of women treated who will not get the breast cancer, but 1 of those women might. And again, this is if you started HRT at 50 and had it for 5 years. So compared to never used. So that's quite a few women need to be treated. And there are other aspects that might have a much bigger impact on the risk of breast cancer. So in summary, we have this message in the sun, and you have these 3 different messages which have a very different view. This is what people like to hear. Scaremongering. This is being used a lot throughout literature, media, and this is scaremongering. And it's because people don't understand. A 23% higher chance, if you have already, say 10% of the women get breast cancer if they didn't get the HRT, and it goes to 23%, that's massive. But if we have almost no one having breast cancer and it goes 23% up, still no one has breast cancer. So it's really, we need to know from what level we're starting. And so an absolute effect is always, you always need to look at the absolute effect as well. And this gives an indication of if HRT would only be used for breast cancer, do you really want to be treated? So, or are you really concerned? So 333 women treated with HRT, you get 1 additional case of breast cancer. But you also then have to look at about how many women need to be treated to reduce some of the other aspects. So it really needs to be placed in perspective. Okay, so that message, the studies, these are 3 different messages. They mean exactly the same. However, the interpretation is very different, with this scaremongering, and this would not be noted within the media.